Welcome to If You Know Someone with a Vagina.
Or as we like to call it, ICSWAV. IYK.
SWAV. Hi, I'm Sandi.
And I'm Beth.
We're recently retired nurse practitioners, excited to bring you a podcast filled with informative insights, compassionate discussions, inclusive perspectives, and expect a healthy dose of humor. Whether you have a vagina or you know someone who does, this is the podcast for you.
The content of this podcast is provided for general informational and entertainment purposes only and is not intended as, or should it be considered, a substitute for professional medical advice.
Coming up on this episode of ICSWAV, you're in for a treat.
It's time to flush out the medical jargon and dive deep into the burning questions everyone wants to know.
So grab your cranberry juice and let's get to the bottom of why do I have a UTI?
Part 1, the patient perspective. And we're patients too.
So bad.
Oh, it's my turn.
Yes, let's talk about our UTIs. I don't know. We got to get some stats in there, like who hasn't had a UTI?
Right?
Yeah.
Right.
When was yours?
I have no recollection of the time or the place, but I know I've had several. All I really remember are the symptoms, and that's what has stayed with me.
It's like same each time?
Very similar. For me, burning with urination.
Ouch.
And the worst, the frequency. I hate the frequency where you just feel like you got to go every 5 seconds.
Yeah.
And you go and it dribbles out, and then the minute you're done, gotta go. Oh, I hate it.
It's like if I had a dime every time I came back to the toilet. I'd be a rich lady.
I'm a rich gal. I don't know. Probably have had 4 or 5 in my life.
I do know that in the literature it says if you've had one, you're 50% more likely to have more.
That's interesting. I wonder if that's you just recognize the symptoms, like
Yeah,
what
who knows how that's skewed. I don't know. Interesting.
And Sandi, have you had a UTI?
Yes. I have the same memory difficulties surrounding mine. I know I was working as a nurse practitioner seeing patients, so, anywhere between 98 and 2018, somewhere in there. But it's when I was working in the urgent care, I believe. But I had just the worst suprapubic pain. Just
wow.
What the heck is this? No burning, no frequency, nothing. So I didn't know what was happening, or I could have just said, hey, somebody, read my urine, do a dipstick or something. But I went to the emergency room. That's how bad it was.
Oh, wow.
Yeah. So I had to walk downstairs.
Yeah,
Cross the sidewalk.
All the way to
go, hey, can somebody help me? And I couldn't even believe it when the doctor told me that it was a UTI. I was like, you're kidding. You're just joking, right? It was all of that is a UTI. I was just like bent over, horrible pain.
Yikes.
And I'm like, gosh, okay, well, I'm glad just to have the antibiotics and you can send me on my way and
right.
Maybe even have to lose a day of work. So,
well, that's the good thing about a UTI. It's, it's treatable.
Yeah, very treatable if you have a place nearby, like I happen to have. That was very convenient. So it's not that convenient for everyone. And I do remember in my 20s when I do look back and think about times when I did have some burning and frequency and pounding water, because I graduated as an RN at age 21. So
young.
I know, but I'm sure it was after that because as a student nurse or anywhere in our nursing careers, we're definitely holding our pee.
Right? How many times? I think because I remember having one when I was working in the ER. Because I think it's just you're dehydrated, holding your pee all day. You don't have time.
Yeah. Can you watch my patients? You have to do the handoff every time you leave the area. So, you really had a hard time just, running to the bathroom. Yeah. We weren't drinking enough. But, I knew enough to drink more water, even though I would drink it and just go, oh my God, I'm so afraid to pee. I know it's going to burn as soon as I start the stream. And it's just so intense fear. But I just never, I never went for antibiotics for those couple of times in my 20s because it went away.
No, I had the same exact. Like once you know the symptoms and you can feel just the beginning of one coming on, it's just like pound the water, see if I can flush it out.
Yeah. And so I was just grateful that I was able to, if it went more than a day or two, then for sure I would have gone in. And what about those clean catch specimens, Beth?
What about them, Sandy?
Oh my goodness. That's a whole thing about trying to do a clean catch. And I think we should discuss that with our special guest.
What? We have a special guest today?
I can't wait.
So excited.
Yes, Mary Rarica. She's a med tech, and she is awesome and knowledgeable and down to earth. I love discussing anything with her because she's just fabulous. You'll see.
So she's going to run us through how clean catch urine. She's going to run us through what the urinalysis means.
Yeah, every part of the urinalysis, because nowadays it's on your phone, I should say. And it's, if you've heard of My Chart, you can find all your test results in there, and then you're reading them and go, well, what's this? What's that? It doesn't explain everything.
So Mary's going to explain it for us today. It's so exciting.
Yes. We're both so proud and happy to have Mary. So, and you will be happy that you listen to her as well.
What's wrong? Turn on the light. I'm worried about my plight tonight. Why is it hurt? Hello. Now I'm bent over in a hunch. 5 a.m. 12th time I'm up. Empty TP roll. Got some burning, frequent yearning. Calling Uber, things are turning. At the clinic, no shame in it. Please pee in this cup. Wipe toward your ass, yeah, here's the scoop. For pee or for poop every single time. Please try to pee before and after sex. It's a little trick you surely won't regret. Won't you come on and wipe toward your ass? Just make it a habit and wipe toward your ass. Won't you come on and wipe toward your ass? Just make it a habit and wipe toward your ass. Need prevention, hate infections. Remind yourself about hydration. Wear cotton panties, no thongs and crannies. Please don't hold your pee. Wipe toward your ass, yeah, here's the scoop. For pee or for poop every single time. Please try to pee before and after sex. Try to wipe behind you, it's really not complex. Won't you come on and wipe toward your ass? Just make it a habit and wipe toward your ass. Won't you come on and wipe toward your ass? Just make it a habit and wipe toward your ass for you.
Woo! That was one of our favorite Vajingles that we've ever done.
So much fun.
Love that one. Pass it on.
So, Sandy, not everyone listening knows what a urinary tract even is.
You're right. Let's break it down. From the inside out, it starts with 2 kidneys, 2 ureters, 1 bladder, 1 urethra, and 1 urethral meatus.
Or pee hole.
That's right. Let's start with the kidneys. So these are 2 bean-shaped organs, each about the size of your fist, and they're located 1 on each side of your middle of your back. So on average, about 50 gallons of blood per day flows through your kidneys, and it's filtering out waste and extra water. And it makes about 1 to 2 liters of urine per day. I'm picturing like a 2-liter bottle of soda.
That's a lot of pee.
Lot of pee, a lot of hard work.
So attached to the kidneys are the ureters.
Not my udders. Those are your udders.
Ureters. We'll edit that one out. These are 2 tubes that carry urine from your kidneys to your bladder. And it's about 10, 12 inches long.
That's what he said. Liar.
So the ureters use muscles and peristalsis to move urine to the bladder.
Onward to the bladder. So this is a balloon-shaped organ that stores the urine. So from 1 to 2 cups, like a grande coffee from Starbucks. And then the urge of pee usually kicks in around 1 cup, but can stretch to up to 4 cups approximately. Yeah, ouch. Try not to hold it that long, people.
Yeah. And then there's the urethra. This is the tube that carries urine from your bladder to the outside of your body. And in women, the length is about 1.5 inches. In men, it's about 8 inches, give or take.
So that's why UTIs are more common in women. So shorter trip for the bacteria.
Yeah, that makes sense.
Mm-hmm.
And it's short, and it's also close to the anus and the vaginal area, making it easier for bacteria to get in and cause irritation and infection.
Yeah. And then the urethra is sensitive to irritation because it's lined with that delicate mucosal tissue.
And it has a lot of sensory nerves to detect when you need to urinate, but can also feel pain, burning, or stinging. Those are the UTI symptoms.
Ouch.
And the urethral sphincter is a muscle that opens and closes to control when you urinate. That's what you use to hold it in.
Yeah, you know what? It's kind of like a faucet handle. So it's the thing that controls the flow. The urethral meatus, in contrast, is the faucet opening where the urine comes out.
Okay, now we are going to explain what a urinary tract infection is. So urinary tract infections are also called UTIs, and UTIs can affect either the bladder or the kidneys.
Yeah, they're actually, the bladder infections are more common than kidney infections, and they happen when bacteria get into the urethra and travel up to the bladder. So you might hear one of these 4 terms, and they all mean the same thing, basically. So number 1, bladder infection. Number 2, urinary tract infection. Number 3, UTI, like Beth said. And number 4, cystitis, which literally means inflammation of the bladder.
And then kidney infections happen when the bacteria travel even higher up into the kidneys. The medical term for a kidney infection is pyelonephritis. And this is more serious than a bladder infection and can lead to other serious problems if not treated properly.
Yep. And have you guys ever wondered what your provider is typing in your chart as you're listing off your symptoms?
I have, Sandy.
Yeah, let's go through that. What the symptoms are, and I'll give you the inside scoop as to what you might read in your own medical records.
Fun.
Yeah.
All right, so what if I say I have pain or burning when I urinate?
You might see the term dysuria.
Oh, interesting. How about the need to urinate often?
You'll see frequency.
How about the need to urinate suddenly or in a hurry?
Ooh, urgency for sure.
How about blood in the urine?
Hematuria.
Lower belly pain, which can range from dull to super painful.
Yeah, that's what I had. It's called suprapubic tenderness.
Okay, how about urine that isn't clear or maybe foggy looking?
Just cloudy.
What about urine that smells?
Oh, they're going to call it foul.
Ooh. Just remember, listeners, you might not get all of the symptoms we just listed. You might even just get one.
Yeah, exactly. And with a kidney infection, you can have any of these symptoms of a bladder infection. But in addition, usually the kidney infections will cause fever.
Or you might see febrile or pyretic in your chart.
Yeah. Or back pain.
Also called CVA tenderness.
Woo! And that really hurts if they tap on your back. and nausea or vomiting.
Might be written as capital N/V or emesis.
Right. So if you think that you have a bladder or a kidney infection, you need to be evaluated right away by a licensed healthcare provider.
And then your provider can do a simple urine test called a urinalysis in the office, or they might also send you or your urine to the lab for more detailed testing.
For a urinalysis or UA, you give a urine sample. This is when you pee in a cup. And I know you all want to know why you're giving your pee and what the results mean. Like, what are they actually looking for?
Yeah, well, first, the urine gets visually examined for color and whether it's cloudy or clear.
And after they're done looking at it, next is the dipstick. So what is a dipstick besides a weird person?
You're a dipstick.
You are. So, so this really thin plastic, very bendable piece of plastic, and then it has like 10 little pads on it, and these are reagent squares, and each little square corresponds with a different test. So the pads will change color after you dip the urine. The pads will start changing color and on the presence of concentration of various substances in the urine. So that's what makes them change color. So this is either done by a machine or subjectively by a health professional trying to evaluate the color changes within an exact time period. So they got to look at their watch and go, okay, 60 seconds for this one, and whatever. And it's just like, oh my gosh. So it's not easy to do subjectively. And in a lot of cases, this is where the evaluation ends.
But sometimes if your provider orders it, your urinalysis or UA goes all the way to the lab where the medical technician may examine the urine under a microscope. And they're looking for things like specific cells, bacteria, other things.
Yeah, so if bacteria or specifically white blood cells are seen, a urine culture, I want to be clear on that, can be done to see which specific bacteria is growing, and it also assists them with how to treat it.
So you know what? Stay tuned, listeners, because we have Mary,
yes,
and she's going to go into a way more detailed explanation of a urinalysis.
Yay, Mary, she's all ours, but we're going to share. Let's talk a little bit about treatment, just very briefly, that most UTIs are treated with antibiotics because most UTIs are caused by bacteria. So if you have a bladder infection, you will probably need to take an antibiotic for just like 3 to 7 days. If you have a kidney infection, you probably need to take antibiotics for longer. I mean, even up to 2 weeks.
Yeah. And you know what? If you have a kidney infection, it's also possible that you will need to be treated in the hospital. It's that serious.
Yes. Sometimes that happens, and it can even go to sepsis sometimes. So, but that's why you're listening, so we can educate you on these things and you can get stuff treated early. So your symptoms should actually begin to improve within a day of starting antibiotics. But you should finish all of your antibiotic pills no matter how you're feeling. Otherwise, the infection might come back.
And then if needed, you can also take a medicine that numbs the lining of your urinary tract. It's commonly called Pyridium or Azo or Urostat. And this medicine eases the pain caused by UTIs.
Yeah, and not the biggest fan because, listen, it's not an antibiotic. It's sold over the counter, but it's not going to cure your UTI. You have to take it with an antibiotic, but for no longer than 2 days.
Yeah, and we have more on that in our interview as well.
Yes.
Such a good interview.
So, Beth, here's what everyone wants to know.
What?
Why do I have a UTI? Why does it hurt me so?
Glad you asked. So, like we've been discussing, UTIs happen when the bacteria enter our urethra and travel up to our bladder. And part of the problem is just anatomy. Remember, our urethral opening is very close to our anus.
Yes, and it's actually our gut bacteria that causes almost all UTIs, most commonly called E. coli bacteria. So guess what?
What?
we also have a natural protection, which is a healthy vaginal microbiome.
I love a microbiome.
I know you do. Our healthy vaginal microbiome is dominated by the good bacteria, lactobacillus, which maintains an acidic pH, which is the normal healthy pH of the vagina, and inhibits attachment and growth of those harmful bacteria.
Yeah, but you know what? There are things in our normal everyday life that can make it easier for bacteria to invade.
Yes, there are. So here's a list, and we're going to go through them one by one. So one of the most common ones is dehydration. And this increases your UTI risk because the urinary tract becomes dry when you're dehydrated, and it becomes irritated, and it makes the lining more vulnerable to infection. So also, when urine becomes concentrated, it can't flush out all the waste and bacteria.
And you know what? Don't hold your urine either.
Yeah. When you hold your urine for too long, it gives bacteria more time to multiply and possibly makes its way up to the kidneys.
And then let's talk about sex, Sandy.
Baby.
Friction, woo, and movement of all the items during sex.
Right. All the items, fingers, toys, mouths, penis, etc.
That can all move bacteria from the anus toward your urethra.
Here's what you do.
What do you do, Sandy?
You urinate right after sex because it helps flush out the germs. And everyone, can you just please wash your hands before sex? Or better yet, how about we all jump in the shower first and make sure all the toys are clean?
Oh, wow. Party at Sandy's house.
It's a big shower.
All right, here's a big one, wiping back to front. So you're just dragging bacteria from your anus to your urethra.
So everyone, wipe towards your ass, like the song says. Or attack from the back.
I like that one.
Right. If you can reach around, if you're that flexible, reach around and attack from the back.
Attack from the back. And then there's the tight underwear or non-breathable clothing, which can trap moisture and heat, encouraging bacteria to grow.
Oh, and can we talk about the thongs?
No, I don't want to talk about
it. Just say no.
Just say no.
More to come on that.
So there's also something called spermicide, and that's a chemical barrier for sperm, which comes in a gel form, which cream or foam, and it's typically used with condoms or other birth control methods to make them work better. But the problem is it can disrupt your normal vaginal flora, which increases your UTI risk.
Yeah, so if you're one of those people that gets a lot of UTIs and you're using spermicide, you might want to try switching to a different form of birth control if possible.
And then there's changes in hormones, especially during menopause.
Yeah.
So that's when our estrogen levels drop, and that increases our risk of UTIs because lower estrogen means thinner vaginal walls and urethral lining, which makes it easier for the bacteria to adhere. Also, lower estrogen decreases our protective vaginal flora, or the lactobacillus, like we talked about earlier.
Yeah, and the therapy's very easy.
It's easy.
Right? So it's vaginal estrogen, which is a topical therapy that does require a prescription, but it restores the vaginal lining and your healthy vaginal microbiome. So this is such an important and involved topic that we want to dedicate an entire episode of ICSWAB to the vaginal and urinary symptom of menopause, also known as GSM, genitourinary syndrome of menopause. So if you're menopausal and experiencing frequent UTIs, please seek out a licensed healthcare provider that actually has expertise in menopausal care. Here's what's coming up in our interview with our professional medical technologist, Mary Rarica. She's the one who knows the behind-the-scenes details about the examination of our urine.
Like the process of getting a proper clean catch midstream urine sample, how to decipher our urinalysis results, and other bonus tidbits that we never even knew were important.
Yeah. But let me start first with proper introduction. Mary was, like me, a phlebotomist before she was a med tech. I was a phlebotomist a long time ago, working in a hospital. That's where I got my foot in the door. And Mary started as a phlebotomist at a student health center in Northern Illinois University in 1989. And in 1992, she became a medical technologist, in which you must have a bachelor's degree. So, Mary, what can you add to your introduction? And welcome to ICSWA podcast.
Thanks, you guys. I'm so happy to be here. Medical technology. We're those lab people that nobody really knows are there behind the scenes. We don't do a lot of patient-facing stuff. But often we're the ones that know you have your UTI before you even have it.
That's
or
right.
before you have your conversation with your provider, right?
Tell us about your UTI.
Have you had a UTI? And God bless medtechs. Just let me say, I used to call all the time and had the best conversation. I've learned more about lab results from a medtech than I ever did from any mentor that I had or physician. You guys are awesome, and I appreciate everything that you do.
Oh, thanks.
Wow.
Yeah, we're pretty smart folks.
Yeah, you are.
Back to Beth and I spilled the beans about our UTIs. If you want to, you could share if you've ever had a UTI.
Well, I've had several in my life.
Oh, sorry.
So my first one was especially memorable because I was working as that phlebotomist at the student health center. And so I was seeing a lot of UAs coming in. And back in the 80s, we like to wear really tight pants. And when you start at a...
Dittos.
And, you always hear about the college freshman 15, right? So we're gaining weight.
yeah.
Still trying to get in those tight jeans. We're laying down on our bed to zip them up.
Oh, Jordache.
Yes.
For sure.
That was the style. And then all of us thought it was so cool to wear a thong, right?
No.
Not all over.
We talked about that in one of our podcasts. It's like the entry
The conduit for poop to get into the urethra.
train.
Yeah, exactly.
Yeah.
Little bridge right up in there. Yeah.
Anyway, it happened fast for me. Like I went from feeling a little like, oh, something's kind of stinky. And when I go pee, it hurts a little bit when I go pee.
Mm-hmm.
And then I remember walking to class and like all of a sudden I got all this pain like in my pelvic floor and in my back.
Oh, wow.
Whoa.
And I had to go pee like now, And so I was like, oh my gosh, this is something different. And like, my mom never talked to me about UTIs. I had no idea what was going on.
Yeah, I don't think you did.
No, so I went to that student center and I saw one of the providers there, and they said, "We think you have a UTI." And then I gave a urine sample, and they did a bit of an exam, and they figured out that not only did I have a bladder infection, I had a kidney infection. It was going all the way up.
Well, that was fast from start of symptoms to when you went in.
Yeah, it was very fast. And, we did attribute it a little bit to sex because, we were experimenting in different ways. And then also just that paired with wearing tight pants all the time. So they were like, get some cotton undies and wear some loose.
That's what some of us were wearing.
That's what my mother would have liked me to have been wearing.
Oh, yeah. So I'm from the granny panty generation.
Yeah. Now it's a little different. I don't, I have thongs, but...
You know what?
I've never owned a thong. Never.
Really?
No, I tried when I hated it. I think it was off in 5 minutes.
I don't have the thong butt. That's what it is.
Yeah,
anyway.
something like that. But back to the experimentation, the sexual experimentation. Why do guys have to? I'd like to. If there's any guys listening out there, why do you have to do a drive-by as you're going from? You like have to slide something past the
the one hole to get to the other.
and then go into you like up and down, and then go into the vagina, and then introduce all this E. coli to the vaginal and the urethral area where the pee comes out and the E. coli crawls in. Don't do that.
Or even not the penis, but using fingers in the anus and then introducing it to the vagina. It just ends up
Good point.
bringing all that, because our poop is made up of bacteria.
Yeah.
And that's usually the bacteria that causes the UTI.
Yeah, 90%.
So if you look at poop on a slide, it literally looks like just a bunch of bacteria.
So I have a question.
Yeah.
Because I never had pain, but both you ladies had pain with your urinary tract infections. What kind of pain is it? Just curious.
Mine was stabbing pain in the suprapubic area. Bend over, slide down the wall. This couldn't just.
Is it like a cramping?
Mm-hmm.
It's a cramp, but it's like
it's also
steady.
Yeah, it's like. Well, I know my first infection, I still remember it. Like, I sat down on the ground when I was walking on the quad.
Oh, wow.
Because it was so, and I thought something had to be killing me.
Right.
Like, it went from 0 to like a 6 or 7 on the pain scale in a second.
Yeah.
So, and then also, pain with urination. So I've heard people like talk about kidney stones and how painful they are. But this was like, you didn't even want to start peeing because you knew it was coming.
Yes.
Do you know what I mean? Like
hesitancy. When you went for your urine test, I don't know if you remember, but it was like, how were your instructions and everything? Here you are in pain.
Yeah.
You're like, here, we need a sample of your urine.
And actually, they were really good at the student center with giving instructions. So like, that's actually where I learned how to give good instructions, was that first encounter I had at the student center, was because they were very thorough and they gave very, very thorough instructions. I think because they were used to dealing with people like me whose parents had never talked to them about UTIs and who, dealing with a lot of young people. I graduated high school at 17 because I have a late birthday. So I was like only 18 or 19 when this happened. So it's like young people that this might even be the first time they saw a physician or a provider without a parent, right?
Definitely.
So they're like, we're really good about giving those instructions, like it's even down to
university.
Wash your hands before you start all of this, like, because we're walking organisms, right? We have normal flora all over our bodies. And if you don't wash your hands, depending on what you did, the last thing you did before you wash your hands,
there could be stuff there. Ever being told that, and that, you picture yourself getting a cup, you walk into the bathroom, and what's the first thing you do? Lock the door.
Right.
How much E. coli is on that doorknob?
Yeah.
And then you just you take out the little wipe, but you haven't washed your hands.
Mm-hmm.
So I don't remember ever being told that. I know there's people who have been told that, but I had never.
Well, and I think too, that's one of the things, like, and you guys probably as providers too, you get really used to like, you have to like give your instructions at the level at which they'll be well received.
Yeah.
So, like, I never thought about washing my hands until I became a med tech, and then you're like touching all these other samples. So it's like you wash your hands before you go to the bathroom, and you wash your hands after you go to the bathroom when you're a lab tech. Now they give you the cup and the little packet with the wipes, and there's one wipe in there.
Yeah.
Back in the day, they had 3 wipes in there, right? So you would wash your hands, you would open up that packet, and you'd have 3 wipes. One was to wipe down the right side of your labia. The other was to wipe down the left side of your labia, and then the other one was for the middle. And you would throw away those in between. So now, if you only have one wipe, what do, right? So you have to give the instruction that you take part of it and wipe the right, and part of it and wipe the left. And now you have clean hands, right? So you can turn it over and wipe down the middle. But I don't think they're giving that instruction at all. I think they're just telling you to wipe from front to back.
Yes.
With the wipe just one time.
Mm-hmm.
Well, tell our listeners what's the point of wiping the 3 times?
Well, the labia are very, depending on the person.
And we're talking about the inner labia here.
Yes. Yeah. It can harbor its own little microcosm of bacteria.
Mm-hmm.
And epithelial cells, right? So,
right. Are those the squamous epithelial cells?
Yes. So they're the kind
show up on our UA.
Yeah,
okay.
Yeah, the squamous epithelial cells, which sometimes will harbor their own kind of bacteria, which give a different kind of infection that we get, which is called bacterial vaginosis. Right.
Yes.
Gardnerella. That's a whole other probably podcast too.
It was podcast number 2.
Number 2. What's that smell?
Right. So the reason you want to wipe is because you want to find out what's in the urine itself. You don't want to have all this stuff that's on the outside.
It's confusing.
Contaminating your urine.
But it's good for people to know because we want the lab and the provider want to know what's going on.
What's causing the
inside the bladder.
Right.
So you have to clear out everything first. So by wiping and then letting some urine out and then collecting the specimen.
Right.
So
right, because the reason for the midstream is what they call it. So you pee a little bit, you hold it, and then you put your cup under and you grab the midstream is because we never fully clear our urethra of all of the urine that's going to come out of our bladder. Even if we bear down and push out as hard as we can, there's always going to be some of that wetness left behind.
Interesting. Okay.
And so it can, especially urine is a sterile fluid.
So they
under most normal circumstances, there shouldn't be anything in there that bacteria.
I'm
maybe
still not going to drink it unless I'm in a lifeboat in the middle of the ocean. I don't care what anyone says.
Yeah.
I'm drinking urine.
No.
Unless I have to.
No. Yeah, so urine kind of hangs out in the urethra. And if it has bacteria in it, it can fester in there. Kind of envision it almost like this little ball of bacteria just, multiplying because they double every 20 to 30 minutes.
Wow. Yeah.
And so I feel like it's this little ball. We want to get that out there.
Yeah. So the problem, is this just me, is when you pee, it's not like when a dude pees.
Right.
And it's mine can sometimes go left or right. The other day I was in the bathroom, I'm wait, why is it going? It's going backwards. I'm my own bidet.
Right. Yeah.
That's happened to me. I thought the same.
Right.
That's why we're podcast partners.
Whenever that happens, when that happens to me, the one time in every 3 years where I'm I have to pee so bad, I'm going to just sit by this bush and do it.
Oh,
and then you end up peeing on your
all
feet.
over the place. Yeah.
And then it'll do or a 360.
Yeah.
It's just
everywhere.
You're
everywhere. Yeah. Well, that's because you're those labia that we were talking about, they kind of clamp down on your urethra to protect it, right? So if we sometimes, because I know myself, after I do the wiping thing, I'll use that wipe to kind of hold my labia open a little bit, at least to get the first part of that midstream out, not the one that I'm going to collect.
Right.
And usually then I'll have an easier time hitting the cup if we have those lips spread a little bit.
Well, see, that'd be nice if somebody told you that.
But nobody's going to have this conversation with you. It's really unfortunate because
I can't tell you how many times I've sat in the bathroom with that cup and it's going everywhere. I'm like, oh my God.
And I did.
And then you pull it out. Go, do I have enough in the cup?
Yeah.
I don't know.
Well, and I have finally had to, because it was going all over the place. And that maybe could be from some swelling around
Right,
the
that
for
too.
reasons, right? But I did have to touch the cup up in there because
And you're like, oh no, I
Yeah.
contaminated.
but it's like, but that's all I could do.
But if
because I
you're
couldn't
clean,
catch it. I couldn't catch it.
Yeah.
So
if you do the
spread
clean
your
part,
labia and then
Yeah.
spread them.
Yeah, I didn't
just
spread your labia.
And what about the cap? It's like, no,
Oh,
just
yeah,
take off the cap, and then people are putting it like on the back of the toilet or some shelf that's not clean or the
Yeah.
sink, and they're putting the cap down
Yeah.
right on it instead of putting it maybe upside down on a paper towel.
That would be ideal. If you put it face up on the counter to avoid that.
Well, I'm interested. What happens when you get the urine? What do you do with it, Mary?
Yeah. What are you doing to our urine?
Yeah.
What are we doing? So if we know, we'll have an order from you all, from the provider. So it'll usually be either a urinalysis with reflex to microscopic, which means we do this thing called a dipstick. It gives us 10 results. For UTI purposes, the most important of those two pads or tests are the leukocyte esterase and the nitrites. So leukocytes are white cells. Esterase is a toxin that our white cells give off when they're trying to fight a bacteria.
Ooh.
So the dipstick is testing for the leukocyte esterase. It should correlate. Then if it's positive, we'll do a microscopic. We should see white cells in that urine, right? So if we get leukocyte esterase positive, that usually means a UTI. But some bacteria will cause a leukocyte esterase response and some bacteria won't, which is why we almost always pair that leukocyte esterase with the nitrite, because what nitrite is it's a something that bacteria give off when they're dying. Your nitrites will go up the longer a urine sits because of that. I alluded to it earlier, but bacteria will multiply double every 20 to 30 minutes, especially in a urine that's sitting out on a counter and isn't refrigerated.
That's why you refrigerate urine.
That's why you refrigerate it, because warm, wet, things, even room temperature is warm to them compared to a refrigerator. So you want to either do the UA right away, within an hour of collection, or you want to put it in the fridge because you don't want that to give you some false positivity, right?
Right. So if you have nitrites, but no leukocytes, that tells you that it's probably not an infection. Maybe it's just been sitting out.
Well, no, that's not necessarily true, because some people just don't fight infections as well as others, right?
I know, strong.
So you might get nitrites. Now, if it is just all you're seeing in the microscopic is bacteria and there's no white cells whatsoever, I kind of suspect that urine's been sitting around for a while. Because everybody fights it off a little bit. Now, if you see a ton of white cells, right? Usually that means that it's a pretty severe infection.
Yeah.
So
some of the other things that are in the urinalysis, there's a lot of things. We won't go through them all because we just want to concentrate on the ones that might have something to do with infection. And I know blood is one of them. So a lot of people say, oh, there was blood in my urine. What does that mean? Because there's blood in urine and then there's RBCs that are, again, with that microscopic part, like the WBCs are. So,
yeah, you can have a positive blood without having whole RBCs, because RBCs are those cells in our body that they don't have any nucleus. They're really easy to break up. So especially if your urine, it has a really low pH, your red cells are going to burst.
Okay.
They'll just explode, and then you'll have a positive blood on the dipstick, but maybe no RBCs in the microscopic. So the microscopic, we're looking for cells.
Mhm.
And with a dipstick, we're just kind of looking for hemoglobin, which is the part of the red cell that is present on the red cell.
But are you going to
It's-
see RBCs or blood typically if somebody has a UTI or no?
You can if it's causing trauma.
Yeah.
It'd have to be pretty bad.
Okay.
Yeah.
Yeah, I usually
Usually more
See
like
some
kidney
blood
stones and stuff like that.
over RBC.
Yeah.
And quite a bit of just trace usually blood.
Yeah.
in
That's
there.
because the bacteria try to stay alive and they'll eat the RBCs.
Oh, okay. So
Well, I'm thinking like somebody who's getting their results back on their phone, or on their My Chart, and then they're looking at this and they see, what are they looking for, if they saw blood, if there was positive blood.
Blood by itself, I would be worried about other things, not UTI.
So they're probably going to get a call from their provider saying, hey.
Yeah. Blood paired with crystals, I would think kidney stone. Blood by itself, yeah, you want to go back to see your provider to
Yeah.
talk about what that might be.
Well, especially then you want to look at the RBCs too with that. So if it's above a certain number,
Yeah.
then you really need to go get your urine retested to see maybe it cleared out after the UTI cleared out, but you do need a repeat probably in 2 weeks.
Yeah.
Before you arrived, we had a discussion about beets.
Oh, yeah.
Because we've read different things, but like my recent thing that I read was that it's like a genetic thing. Just like if you're able to smell asparagus pea, that's something in you that you can smell it, not that you make it.
Right.
So with beets, it's like a genetic thing too. Like Beth and I can eat beets and not have red urine.
Mary?
What about you?
I mean, I'm not a beet fan.
Oh,
They taste like dirt to me.
I've never.
disqualified.
But I will say, like, it's interesting, like normal urine, yellow, clear, right? But things like birth control pills, marijuana, can change the color of the urine. Literally, I've seen glowing green urine from birth control pills.
No way.
So color in and of itself, without any like cloudiness or weirdness, can just be something you're taking, something you're eating.
What does weed pee look like?
It also has
I wouldn't
like
know personally.
it also has like kind of a green sheen to it.
Oh, that's interesting.
It's interesting.
Not a birth control. It's like almost like a green highlighter marker.
Wow.
And I'm not sure which pills it is because not everybody, and it could just be how your body metabolizes.
Another
that.
genetic thing.
Yeah.
Well, speaking of color, so I just wanted to point out to our listeners also is that when you do get treated for a UTI, often they'll give you a prescription for Peridium. And that will
like Peridium.
Yeah, I'm scared.
In a lab.
I'm scared of Peridium to give it to people sometimes because it's only to be used for the first 2 days. Because if you have a UTI and you're taking Peridium and antibiotics, within 2 days, your symptoms you should not be having burning and all that. But if you continue the Peridium or so there's two things that can happen. If you keep taking it longer and you think you're getting better because you don't have symptoms, but if you stopped at 2 days and you had your symptoms came back, you would know you're not on the right antibiotic, or maybe it's something else. But the sooner you know that, the better, and you need to call your provider back. The other thing is if you get it over the counter, which they do have forms of it over the counter, and you just start taking it and you keep taking it for a week while you have a UTI brewing, by the end of the week, you could have a kidney infection, fever, and whatnot. But it's a dangerous medication, I believe, too. But it also changes the urine color If, let's say, some people take it and then they come in and say, I've got a UTI, I took a peridium because it's killing me, and now you can't read the dipstick because of the color.
Yeah, the color of peridium urine is bright orange.
Mm-hmm.
It literally looks like you have a rusty urine going on that also glows in the dark.
So don't wear your white panties or white pants because it will stain.
No. Yeah, it stains everything, and we can't read the urine dipstick. It's not even worth it to do a dipstick in that situation because the color interference, like it's going crazy, which actually cranberry juice is very helpful because it changes the pH of your urine.
Makes it more acidic.
And makes it less habitable for most
inhospitable.
Yes.
Without spitting, if we can. Spittle.
I had read, though, the cranberry pills, because they're more condensed. Concentrated, thank you, is the right word. And I guess you're not getting all the sugar, too. But that can help.
From juice, like you would juice.
Yeah, I think when we're talking cranberry juice, we're not talking cranberry cocktail.
Right.
We're talking cranberry like
Cosmo?
Not. That's how I like to treat my UTI. But yeah, there usually isn't much added sugar to real cranberry juice, but it's also really hard to drink.
Yes.
It's not very tasty.
So if you're taking antibiotics, you're drinking cranberry cocktail, you're really inviting a yeast infection at that point.
Listen to the Yeasty Girls.
Yes.
Right.
Podcast number 1.
Episode number 1.
Now, the cranberry won't affect the results of urinalysis.
No.
Okay.
No.
But peridium will. All right.
Peridium definitely will.
You know, we did a survey and we had over 70 responses. Wow. Do you mind going over our survey with us?
Not at all.
Yeah, just kind of see some of the things.
You're so knowledgeable, Mary.
Yeah,
we don't
want to let you go.
Call me anytime you want a lab perspective.
We will. So anyway, we preface this survey on females who have been professionally diagnosed with a UTI or a bladder infection. So each one of the respondents, female and has been diagnosed with the UTI. So the first question, there's only going to be 5 of these questions. First question, if you gave a urine sample, peed in a cup, did you receive verbal instructions on how to collect a midstream clean catch specimen?
Yeah, it looks like a lot of people felt like they got good instructions. So,
we'd say less than 50%.
A little less than 50%. Most people nowadays are getting their instructions from a poster on the wall, right? In the bathroom at the laboratory that they're collecting at. And like 22%, 23% said that's how they got their instructions. I wish we would go back to giving verbal instructions ahead of reading that poster because...
Well, everyone learns differently.
Everybody learns different.
Yeah. I think it's great to have both.
Well, for our listeners, don't be afraid to ask questions, too.
Yeah.
If you don't understand, speak up.
Yes. So then we, because we had discussed this before, I wanted to ask your favorite question was, if you did give a urine sample, was one of the instructions to wash your hands first? And plus I turned it around, so yes wasn't the first answer. So they had to really read it, think about it.
Yeah.
But it's interesting that
almost 70%.
Yeah. That's pretty good.
Were given that instruction. I was surprised by that. I felt like that might be one of the fallouts, but
but 30,
maybe not.
A third of the people weren't.
Yeah.
So that's, I mean,
they went in with their dirty hands.
A third. 3 more questions. How was your most recent UTI, which you were treated for with antibiotics, diagnosed? And we looked at if they actually had a urinalysis. And I was actually happy to see that at least 60% actually had their urine tested. But, and then this was an interesting one because the next answer was, I had a negative urine, but I got antibiotics anyway, right? Because they're like, well, it's 3 days. So by the time they call with results, so that's 20%. So
This is why we have big, bad organisms that are resistant to antibiotics out there. So we haven't talked about that a whole lot, but the more antibiotics we use, the more we have bacteria that know how to get around them.
Mm-hmm.
So not just a urinalysis, but also following up with a urine culture is so important.
Yes.
Because it tells the doctor what organism is in there. So E. coli is the big one, but there's others. And then what antibiotics it's actually going to react to. So whether or not it's sensitive or resistant, those are the words that we use in the lab.
Right.
So for our listeners, if they're seeing their results on their phone or their MyChart, once again, what are they going to see? They're going to see the urinalysis, and then they're going to see a culture.
And they'll probably just see the organism that grew. The provider is going to get this additional report about the sensitivity for antibiotics.
Okay, but the person or the patient won't.
Person probably won't see that. But this is why sometimes your provider will go, I'm really sure you have a UTI. I'm going to give you this antibiotic, even though I don't have the results yet, like on the day that you see them.
Mm-hmm.
And then 2 days later, they call you and they go, we got to switch your antibiotic. It's because they find out that bacteria that grew maybe was resistant to the first antibiotic that he or she prescribed to you.
And the one other thing about this question I wanted to point out was some people were diagnosed based on symptoms only via telehealth. That's a big thing right now. And no urine test was done. And after your last urinalysis, were the results explained to you in a way you understood? Nobody, I can tell you, explained it like Mary just did.
Right? Everyone's going to be like, I know my urinalysis now.
But it was interesting. Out of the 70 people, almost 60% said, yeah, it was clear. I totally got it. But we were talking, maybe I poorly worded this question, that it was just like, it
Positive
was clear because did I have it or did I not have it? And so it was yes, but almost 30% either they didn't understand it at all or only somewhat. So there's still a lot of room for improvement there. And then the very last one is if you first saw your urinalysis perhaps on your phone or MyChart, like Beth's been bringing up, how confident are you that you could understand what the results meant? And I was a surprisingly 30, almost 33% said, oh, I'm very confident.
Yeah, and 70% were between somewhat and very confident. I mean, obviously, being a lab tech, I understand everything. If I don't, I should be out of a job. But, some people badmouth Google and stuff like that, but you can Google almost everything, and AI now will give you a really good description, but nothing is better than having a conversation with your provider.
Absolutely.
Yeah, or your med tech.
Yeah.
My story sticking to
you
it.
should all have a lab friend on your quick dial.
Yeah. On that note, Mary, what's your phone number so our listeners can call you?
I just want to personally thank you for joining us today. It's been
fascinating. Learned so much.
Have me back anytime.
Let's do it.
Yeah, I mean, if we learned a ton,
we could talk another whole hour.
Easy.
Seriously.
But I wouldn't be mine.
We just might after we turn this off. But
no, thank you. I feel like the lab, we need more exposure.
Absolutely.
So and we're pretty smart folks.
Yes.
You are. The hidden heroes. Hidden heroes.
The
hidden heroes.
The double H'ers. But thank you for listening, folks. And thank you, Mary. And we'll hopefully have you on again in the future.
Thanks, guys.
And now, here's what partners need to know.
First, UTIs are not sexually transmitted, but sex can trigger them by introducing bacteria into the urethra through normal occurring friction.
UTIs are very common and can happen for many reasons, not just sex, including hygiene habits, hormone changes, or even simple anatomy.
Speaking of hygiene, both you and your partner should be washing hands and genitals before and after sex to reduce bacterial exposure. And urinating after sex can help flush out bacteria, so don't get mad if she wants to postpone the cuddling. It may also help the vagina prevent infection by avoiding certain irritating products like spermicide, scented wipes, and douches.
So don't douche.
And don't be a douche.
So symptoms may affect intimacy. A person with a UTI may feel pain, urgency to pee, or fatigue, and may not feel up for sex. So respecting boundaries and allowing time to heal is key.
Yes, and a partner can also be supportive by not overreacting when your partner has a UTI. UTIs are easily treatable with antibiotics. Being understanding, asking if your partner is comfortable, and offering help, just like getting water or picking up their prescription, can go a long way.
Lastly, provider insights.
Beth, have you seen this recent commercial with this lady on an airplane? And it kind of infuriates me.
Ooh, tell me why.
Well, you see her messaging a doctor apparently with her symptoms, and she gets a message back insinuating that her prescription for her said UTI will be waiting for her at the hotel when she lands.
I mean, come on, right? While it's convenient and sometimes the only option, it is certainly not ideal for diagnosing UTIs.
Right? So, yeah, there's no proper exam or urine testing. And you know what that means?
What?
A higher risk for misdiagnosis and ineffective treatment.
Right? So it's safer and more effective to get evaluated in person when possible.
Yeah. So let's talk about frequent UTIs.
Okay.
Yeah. I mean, that whole scenario, I was thinking about that lady and saying, well, does she have frequent UTI?
What is a frequent UTI, Sandy?
Yeah, well, I'll tell you. And if it's her first one, it's like, come on, you
Right?
You just need to dive in a little deeper. Sorry, people, I'm still upset about that commercial. But here's the definition of frequent UTIs. If you've had 2 or more UTIs in 6 months or 3 or more in a year, that's what qualifies as recurrent UTI. And it requires a deeper look.
All right. Well, first, get proper testing every time, right? Make sure the UTI is confirmed with a urine culture, not just diagnosed on symptoms alone. Why?
Why? Because not every burning pee is a UTI. So we've talked about this before, but other things that cause burning pee is like even a yeast infection or BV, bacterial vaginosis, or an STI, which is sexually transmitted infections, can mimic UTI symptoms.
Plus, repeat antibiotic use without confirming the bacteria can lead to resistance or masking the real issue.
Exactly. So speaking of resistance, if the UTIs keep coming back, ask for a sensitivity test with your culture. This is the part that shows which antibiotic actually works against the bacteria causing your infection.
Yeah, and let's stop self-treating without medical input, right?
Hallelujah.
We know it's tempting to take your leftover antibiotics, right?
Yep, or someone else's antibiotics.
Or, you take that over-the-counter Peridium, but that can mask symptoms and delay treatment.
Yes.
So what's the best course of action, Sandy, for those of us who have frequent UTIs?
Well, I would see a urologist or a urogynecologist because a specialist can rule out anatomical issues like incomplete bladder emptying and urethral abnormalities.
And you can also check for hormonal changes, especially if you're menopausal, and that can be done by whoever does your regular pelvic exams, or you can find a provider who specializes in menopausal care.
Yes, absolutely. And don't settle for this cycle of antibiotics and frustration. Push for answers. See a specialist and get a personalized prevention plan that actually works for you. And don't forget the basics.
Vajingle.
One more time.
What's wrong? Turn on the light. I'm worried about my plight tonight. Why is it hurt? Hello. 12th time I'm up. Empty TP roll. Got some burning, frequent yearning. Calling Uber, things are turning. At the clinic, no shame in it. Please pee in this cup. Wipe toward your ass, yeah, here's the scoop. For pee or for poop every single time. Please try to pee before and after sex. It's a little trick you surely won't regret. Won't you come on and wipe toward your ass? Just make it a habit and wipe toward your ass. Won't you come on and wipe toward your ass? Just make it a habit and wipe toward your ass. Need prevention, hate infections. Remind yourself about hydration. Wear cotton panties, no thongs and crannies. Please don't hold your pee. Wipe toward your ass, yeah, here's the scoop. For pee or for poop every single time. Please try to pee before and after sex. Try to wipe behind you, it's really not complex. Won't you come on and wipe toward your ass? Just make it a habit and wipe toward your ass. Won't you come on and wipe toward your ass? Just make it a habit and wipe toward your ass for you.
I'm Sandy.
And I'm Beth. And if you have a vagina or know someone who does, then please like, share, and comment with your thoughts or topic suggestions.
You can find us on all podcast platforms like Spotify, Apple Podcasts, and YouTube.
Bye, everyone. Thanks for listening. And now, here's what partners need to know.
First of all, I was fine.
Apparently not.
You know, look forward to our episode. Jesus Christ, never mind. Get that for it.
Speaking of hygiene, Beth,
Yes, Sandy.
both of you, your partner, both you fucking it.
Me, because I inserted my fucking self. That's why.
It threw me off.
Oh, should we just start? Should we start again? Wait, we can just keep going, right?
Okay.
And now, here's what partners need to know.
Kim, no, I can do it.
Okay. And now, here's what partners need to...
God damn it, Sandy. God damn it.
So weird. Okay.
And now, here's what partners need to know.
Jesus Christ.
Giggle McGee. Giggle McGee.
Pinch myself. Okay.
And now, here's what partners need to know.
Jesus.
First, okay.